Hey crew, what's up? It's Dr. Jared here at Health and Performance Center. We're going to talk about one of the conditions that we see quite often here in the office, especially after the holidays. Maybe you took on a little bit too much debt, had a little bit too much fun, who knows? The big thing is it's headaches. We see a lot of people with headaches for a lot of different reasons, which is why we have this nice drawing up here to kind of talk about where do headaches come from and how do we kind of quantify them, qualify them, and attack them effectively. Well, we have environmental factors, we have chemical factors, and we have mechanical factors. And as we move across this list, we get a little bit more intense of generally what we see. Now, over here in these environmental and these chemical factors, that's more of your classic migraine people, which is actually a fairly low percentage of the people who suffer and have disabilities due to headaches or reduced capability due to headaches. Most of those people are falling in this mechanical realm where there's postural abnormalities, there's muscle trigger points, there's myofascial pain syndromes. They're sending a lot of referral pain that gets so intense that it mimics that of migraines and how bad that it is. So we're always looking at environmental causes, we're looking at chemical causes, and we're looking at mechanical. So mechanical is more of your posture. Chemical is more of your nutrition, kind of what are you putting in your body, as well as potentially where are you at in terms of hormone fluctuations, because that's a big issue in the female population, as well as just environmental. What's your work? Stress level, what's, how often are you seated? Do you have a standing work option? A lot of these other variables that we can kind of work with, but we're always filtering over here into this mechanical where we see the majority of problems happen. And what we see is even with those patients with migraines who have a lot of difficulties trying to get on top of their symptoms, if we really eradicate what's all going into this cup, we can reduce the level, okay, of what's going into this cup, because once it gets overflowing, that's when you're really deep into a bad headache scenario. So by managing these mechanical factors in terms of postures through chiropractic adjustments, through our soft tissue mobilization or deep tissue massage with Graston technique, as well as our postural rehabilitation, we're able to really significantly reduce the mechanical things that go in there. The nutritional consulting that we do further intensifies that, and then our rehabilitative processes are exactly awareness of how do you follow the rules? How do you make sure that your environment, where you're putting yourself on a daily basis, is taking you to a good direction as opposed to leading you towards your next major headache scenario. So this is what we do here at Health and Performance Center to help people with headaches, which is a massive problem through our population, especially the technological working population, and it just doesn't need to be that way. If you need help, please look us up. We'll take care of you.